Is it still morning? It is still morning, right? It's still morning somewhere in the world. Greetings, ladies and gentlemen. How's everybody doing this morning so far? I feel your enthusiasm kind of like waning. How is everyone doing this morning? There we go. There we go. There we go. When you have such an esteemed panel as we have this morning, we have, should I make introductions? I guess I should probably, I'll actually do introductions myself, and then we'll pass it along. So this panel is going to be very unconventional, and I'm an unconventional moderator. My name is Louis L. Reed. I am the national organizer for Cut 50. Cut 50 is a bipartisan criminal justice initiative co-founded by CNN political commentator and now Reform CEO Van Jones. Some of you, we got one Van Jones fan in the room. No matter where I go, there's always one Van Jones fan in the room. And we are going to be talking about a very important subject to all of us, I believe, and that is dealing with the intersection with criminal justice and mental health. So without further ado, I will pass it over to my esteemed panelist, Mr. Francis Greenberger.
Hello, everybody. I'm Francis Greenberger, founder of the Greenberger Center for Social and Criminal Justice, together with my partner, Cheryl Roberts, who will introduce herself, partner in the cause of criminal justice reform, not in other ways. Just to keep it. Yeah, right. I was on a journey which is not untypical of parents of people who get involved in the criminal justice system. In the case of my son, he's somebody who had many mental health issues before he became involved. And anyway, that's sort of the perspective that I bring to things, and I guess we'll get into it more as the panel goes along.
I'm Cheryl Roberts, and I have the privilege of being the executive.
And your thing isn't going.
Director.
Yeah.
It says it's on.
Is it? Okay.
It's not on, is it?
It's not on.
No. How's that? Okay, so I'm Cheryl Roberts. I'm the executive director of the Greenberger Center for Social and Criminal Justice. It's really a privilege to be the director. My background is I was a former local judge and an attorney. So I bring that to the table, and I guess we'll get into more in a few minutes.
And I'm Matthew Demick. I'm a judge in Brooklyn. I preside over the Brooklyn Mental Health Court, which was the first mental health court established in New York State.
Thank you. I want to thank all of you guys for being here today. Thank you guys for your intellectual property that you're going to share with us. Ladies and gentlemen, all of these esteemed panelists are far much more smarter than I am, so they're going to make me look better than I actually look. So today we're going to be talking about alternative approaches in the mental health arena, and I want to first I was raised well. I was raised by my grandmama. So anytime you have a woman in the room or a woman on a panel, you always defer to the woman. So I want to first toss it over to Cheryl and ask you, Cheryl, what brought you to this work? What brought you to the work, and what lit your passion for not just for criminal justice reform, but the intersection of criminal justice reform and also mental health?
Thank you. The first is really Francis Greenberger. I met Francis when I ran for the New York State Assembly. I didn't win, but I feel like I won because I got to work with Francis. And he is a social entrepreneur and is deeply committed to criminal justice reform, and it's really contagious. So that's, I think, the first thing. And as a local judge, and I'm actually also a licensed bond agent, what I saw as a judge and as a bond agent is that we are criminalizing people with mental illness and substance use disorders. And our courts have become social service agencies of our time. And at some point, you know, folks get funneled into the criminal justice system, and they're before a judge who doesn't have a lot of good options often. So we are trying at the Greenberger Center to give judges more options. And then I guess personally, because I have been harmed by a person with untreated mental illness as a child, and I think for me, had there been, even as a child, understanding that there was a place to get treatment. I think that would have made a big difference. I think people who are harmed by others need to know there's a place where the person can get well. Otherwise, bizarrely, you sacrifice yourself for the person who's actually hurting you so that they don't go to prison. And we need to change that thinking somehow by having a new set of institutions that provide treatment and provide redemption and provide hope.
That's awesome. That's awesome. Francis, you have a very, when you and I discussed offline about what brought you into this work, and even in your introduction, you were talking about your son. Can you talk to us a little bit about how you got involved and how the issues with your son has impacted your lifelong journey for justice reform?
Sure. Being the parent of somebody who has mental health issues, and my journey has not been unlike many other parents of mentally ill children that I've come to meet and know, is a very challenging course. And my son had his mental health issues showed up when he was 4 years old, and really continued for the rest of his life until today, although he's doing better these days. And at a certain point, his mental health issues got him involved with the criminal justice system. And as I was going through advocating for him and being the best father I knew how to be, I found that there was something wrong. You know, I went to the attorney, the prosecutor in his case, and I said, look, you know, here's a file cabinet full of his mental health reports and all the things that are wrong with him. Wouldn't it be better to get him a referral to a mental health facility rather than put him in jail? And this guy was very sympathetic, and he said, yes, if you can bring me a secure facility, then I will consider a referral. And I didn't understand at the time that he was sending me on a fool's errand, because there were no secure facilities. But I looked, and I looked, and I looked, and eventually I went back to him, and I said, look, I can't find any. Can you give me a referral? And he talked to somebody. He said, well, you know, there's one in Staten Island called Harbor House or something like that. Well, it wasn't in Staten Island. It was in the Bronx. Eventually found it. And eventually I got my son accepted there. And when I went back and said, okay, here we are, I got him in, he said, oh, no, you know what? Or he didn't say it. His superior said it. Oh, no, that's not secure enough, even though they had referred it. So I realized that I was in this sort of crazy Kafkaesque world, and that there was something very wrong. And at a certain point, I resolved his case. He got sentenced to 5 years in prison. But I've always had a strong social justice nerve, and something went off, and I realized that I wanted to find out more about this world that I knew really nothing about, and went on essentially a listening tour, and spoke to lots and lots of people, including Judge Emick, who was very informative, and discovered some remarkable things that, one of the things I discovered was almost everybody I spoke to had said that the system's broken, that it doesn't work, and that it needed changing. And that was very surprising, because usually heads of bureaucracies defend what they're doing, and in this case, most of them did not. I could go on. I don't know how much you want me to.
No, I think that set a great stage. We'll pass it over to Your Honor. And you know, what was it that brought you not only to go to law school, but ultimately what landed you on the bench, and to want to preside over the first mental health court in Brooklyn, which is a very tall order.
Well, I mean, what I'll say about being the judge presiding over the first mental health court is they asked me to take the assignment. That was really why it was. But having said that, I've been doing it for 17 years now, and Louis, if I could just answer your question this way. The chief judge at the time in New York State was Judith Kay, and the district attorney in Brooklyn was Joe Hines. And the chief judge had been to Florida and other jurisdictions where they had mental health courts and wanted to establish one in New York State. And the DA was willing to have Brooklyn be Kings County, the county in the state with the first mental health court. Now, because it was the first, it was planned as a nonviolent felony court for adults. We weren't going to take violent felonies. We weren't going to take misdemeanors. We weren't going to take
You weren't going to take anyone.
One of the first cases referred to the court was a young woman who killed her infant at the moment of birth. Now, that was not a case for the court, but it showed us that if we were going to really help, we were going to have to take violent felonies. And so one of the first cases referred to the court was that. Maybe I should backtrack a little bit and talk a little bit about how the court works, just in 2 or 3 minutes. So we've been in existence now for 17 years. Any defense attorney, any assistant district attorney, any judge in Brooklyn can refer a case to the mental health court. Assuming both sides want to avail themselves of the court, an evaluation is done by a psychiatrist who we have a contract with and by a social worker who's on the court staff. If the person suffers from a serious and persistent mental illness, that would be the criteria to be eligible for the court. Now, I'll refine that a little bit about what I'm talking about. Most of the cases in the court, the accused suffers from major depressive disorder, bipolar disorder, schizoaffective disorder, or schizophrenia. Being PTSD, traumatic brain injury, we have some of those as well. Now, if that's the case, then the defense attorney and the district attorney work out a plea. They work out a plea in the event that the defendant fails the court mandate, a prison term, and they work out a resolution in the event of success. Hopefully it would result in a dismissal, sometimes at a reduced charge with no jail time. And defendant takes the plea, he's released to treatment. If he's in the community, he's in the community. And then we monitor the defendants very closely. I know Judge Fogel spoke yesterday about the dangers of strict judicial monitoring. In these cases, since at this point in time about 40% of our caseload involves people who have pled guilty to a violent felony, we see the defendants every week. And the benefit of that is, of course, I can address any public safety concerns immediately, but the unintended consequence of it is that it creates a community in the courtroom. So that's a general idea of how the court works. And what I'll say is, again, we were planned as a nonviolent felony court, but one of the first cases, aside from that other case, is a young man in his early 20s who committed 2 robberies on the street, was picked up as the police were canvassing, looking for him. He was on Rikers Island and apparently was acting bizarrely, was beaten up, was taken to Kings County Hospital, where the doctors discovered that he was in the beginning of a psychotic break. The district attorney reluctantly allowed the case to come into the mental health court, and the jail term was, quite steep, and he was going to get a misdemeanor and a conditional discharge, probation, in the event that he succeeded in the court mandate. Well, he came to court every week, and his father would come with him, and I remember talking to his father, and his father would tell me they thought he was on drugs. They couldn't understand what he was doing. Actually, he was in college studying graphic design. Well, he was in the court for about, I guess, 18 months, and he did quite well, and he was ready to graduate, and the mother of the defendant asked the district attorney and myself if we would agree to dismiss the case. To the DA's credit, he agreed that if he stayed in the court for 6 more months and did as well as he was doing, that the case would be dismissed, and the case was dismissed. And I think it's been typical of the caseload that we've had over the years. And you asked, I said I took the assignment I mean, it sounded interesting, but truthfully, in the past 17 years, I feel like in a small way, I've gotten the chance to alleviate pain, affect people's lives, and you know, establish relationship with people that don't have that many relationships.
You know, I think it's interesting because there's a notion that those who are closest to the problem are closest to the solution, but often furthest from resources and power. And interesting how when you hear Cheryl talked about the experience that she was exposed to at a young age, and you hear Francis talk about how his child was personally impacted by an issue, which in turn ignited a passion for him to be in this work. And also you as well. It sounds like you are anchored in a space of empathy that you bring to the bench, that you bring when, you know, adjudicating whether it's, you know, whatever disposition that you have to do for a defendant. I think that that's something that's necessary for the work that we do. You have to come from this work from a space of empathy. You have to come from this work from a space of just really caring about the individual and the wellness of a person. So with that having been said, Francis, I'm interested in understanding more about what your perspective is as it relates to the system at large and how effective we are in terms of our mental health outcomes in our criminal justice system. Because the reason why I say that, just this morning I was reading a statistic, 1.2 million people in the United States of America in prison and in jails have a diagnosed mental health disorder. 1.2 million people. 1.2 million people. There are 2.2 million people total in our prison population. That's virtually half. And I can tell you from my own personal experience when I served nearly 14 years in federal prison, and now that I'm a licensed clinician and I'm looking at the situation from the outside in, as well as having the distinct vantage point from the inside out, I can tell you that it's a very, very, very cumbersome task and process to get people engaged in effective treatment. So again, Francis, I'm just interested in hearing your sage wisdom on your perspective on the criminal justice system.
Well, I'm going to zero in on the population that you were talking about, although, you know, there's lots to be said about the full spectrum of issues, and Greenberger Center does political advocacy on the full spectrum, and then we have a great focus and concentration on the issue of the mentally ill. But what you touched on is what I've come to think of as the greatest failure in American public policy.
Talk more about that.
That I can recall. As you know, statistics are all part of this narrative, and you've heard these before, but I'm going to say them again. In the 1950s, we had 550,000 mental health beds in the United States. The population has doubled. We would normally need 1.1 million. Today, my understanding is we have 35,000. We closed, knocked down, abandoned 535,000 beds. Think of how much real estate that is. That's like 535,000 rooms or 250,000 rooms. It's an endless number of buildings. And some of us who have gone up driving north in New York, there were whole abandoned communities of these high-rise buildings that were just broken glass. So we abandoned all of that, and there was kind of a promise, and through what was called the deinstitutionalization movement, that we'd be able to move those people with the help of pharmacological drugs into community-based treatment, or just give them, they would be okay with the medications and everything would be fine. Well, it didn't work out. It turns out that those pharmacological drugs, while effective in 50, 60% of the cases, are not effective in 100%. That let a lot of untreated people on the streets. Ultimately, they committed impulsive acts or had co-occurring substance abuse issues. Anyway, they got led into the criminal justice system, and what did America do? We closed all the mental health beds. We built new prisons, so we would have the missing beds, and we stuck those people in prison. And that's a pretty gigantic failure. Think of the resources. And at some point with my son, I was talking to one of the top mental health people in the state of New York, who a friend, and said, look, you know, I know as my son's father, I'm his advocate, you know, I'm not going to change my point of view, but from a societal point of view, would it be better if he spent a couple of years in jail? Maybe that would straighten him out? And he said to me, no, it wouldn't be. And I said, how do you say that? What was that based on? He said, look, we know if you put a person with mental health issues in jail, they're going to come out worse than they went in.
That's correct.
And that's not good for society, because 98% of all people who are incarcerated get released. So society is going to be worse off taking this form of treatment rather than having them in this form of consequence, rather than having them in a treatment modality. So the answer is, to your question, where did they come from? We threw them out of the hospitals. We thought we had another solution. It didn't work out. And
Your Honor, I see you itching to jump in. I want to hear you. What are your reflections?
Well, you know, obviously I'm an advocate, but that's absolutely right. I mean, if you talk about
Wait, time out. You mean to tell me that a judge, a sitting judge, would say that the system has failed someone?
What else? Well, that's why we have a mental health court, or a series of them throughout the country now. And, you know, what Cheryl and Mr. Greenberger was saying is absolutely true in terms of, I could fill a Hope House, I could fill a secure facility where the DA might be a little bit skittish in terms of letting somebody out because of the nature of the crime. I do have some people that are now participating in the court that are in the few beds that are left in the institutions, and they're doing quite well, but there's nowhere else for them to go and keep the public safe. And it's not like, I mean, they are getting treated well, and I see them every month or so. And
do you see an increased or a marked improvement in their condition as opposed to when they first presented before the bench?
Well, I could say before all assembled here that I've seen miracles. I had one defendant came in, and he came into court for the arraignment, first appearance, and immediately threw himself into the door that led to the jail, and violently, to really hurt himself. I ordered an examination to see whether he was fit to stand trial. He was found unfit. Eventually, he came back restored to fitness. We were able to release him, put him into treatment, and he graduated from the court medicated and treated, and with his family, and I call that a miracle.
Awesome.
All in a year and a half.
Awesome.
And I think the hallmark of the court that we have is, you know, we take the violent criminals, and it's people who have committed violent acts. And, you know, obviously, there's risk involved. I mean, I'm a risk manager as well as everything else, but I always say that you can't be afraid doing the job. You just have to be very careful doing the job, and have to take risk if you want to help. I mean, I think if I told two stories, it might, you know, in 5 minutes, if I have the time to do that.
Please.
So, I mean, recently, just two recent cases we took into the court. Here's a woman, 56 years old, accused of robbery, and had a plea offer of recently, a couple of weeks ago, maybe a couple of months ago, that she would go to prison for 2 to 6 years if she failed the court mandate, and get a conditional discharge on a misdemeanor if she succeeded in it. She's diagnosed with schizoaffective disorder, together with alcohol, cocaine, and marijuana abuse. Actually, her case was delayed because she would come to court at 9:30 in the morning, totally drunk. And this went on for months until we could get her into some sort of a detox and rehab and straighten her out a little bit so that she was able to be evaluated and eventually take the plea. Now, what is terribly sad about this, and echoes, of course, Mr. Greenberger's experience, is that she has a master's degree in education. She taught in the public schools for 5 years before she had her developed a mental illness. Now, she's placed in a therapy community like Harbor House, and so far, so good. Second example I want to give is a 33-year-old Chinese immigrant. No record in 33 years. Charged with arson in the first degree, facing a 9-year prison term if he fails, but he'll still have felony probation if he succeeds. That was the price that the DA wanted to exact if he was going to be able to participate in the court. Diagnosed with schizophrenia. He heard his sister's voice asking him if he was a black wolf or a white wolf. Could not get the voice out of his head. He took public transportation to her house and threw a Molotov cocktail into it with her kids inside in order to stop her voice, these auditory hallucinations that he was having. He is on intramuscular medication. He's in a program. He's working part-time. So far, he's completed 2 years of a 3-year mandate without incident. Just 2 examples.
That's awesome. That's awesome.
I'd like to suggest 2 things. I'm not sure that everybody here understands what the mental health court is, so I'm going to give you 2 seconds on my version, even though we have probably the world's greatest expert sitting right here. Even though he calls himself Judge Emick, I would add the title Dr. Emick to it, because the mental health court is not exactly the kind of courts that we're used to thinking about. In my opinion, they're really social service agencies. And Dr. Emick, when he has an offender in front of him, comes up with a variety of social services approaches to deal with that person's needs in the hope that that will straighten them out. And he sees them weekly, just like a doctor would have a weekly appointment with one of his patients. They come in once a week, and he says, how you're doing, and they describe a problem. He tries to find a solution. If they've done something wrong, like a paternal figure, he tells them. So it's quite an extraordinary court, or innovation of a court that's very different than we might imagine. But maybe also, and Judge, if you want to comment on my comments, please feel free to. Otherwise, I would turn to Cheryl and ask her to tell people about what Hope House is about and what the group we're trying to serve.
He does this.
Yes.
Is that okay? Yeah.
Yes, that's perfectly fine.
So Hope House on Crotona Park is an alternative to incarceration model that we've developed over the last 5 years. And I'm going to tell you a little bit about Morgan's story, and then you'll understand why we needed to do this. So,
And when you say we, who's the we that we're referring
well,
to?
Greenberger Center. Yeah. So
Morgan's my son.
Yeah, Morgan is Francis's son. So Morgan has a serious mental illness. He first was accused of robbing a cab. He was out on bail, and he became paranoid that a drug dealer was after him because he has a co-occurring substance use disorder. He called the police. The police came, and they realized that there was no one after Morgan. So then he started a fire on the stove, watched it burn, and called the fire department, hoping that they would help him. The fire department came and, of course, arrested him. And when they asked, well, do you know if anyone's in the building? He said, yes, my caregiver was downstairs. It became a violent arson. So with that kind of charge, the DA and the judge were really not likely to divert him. And that's because even though Francis found a place to put Morgan at Harbor House, when someone is mandated to Harbor House or any of these providers, it's a residential program, and they decide to leave, they leave. And then the provider has to go get a bench warrant. The bench warrant's issued. The police eventually maybe pick up the person. More likely, the person is maybe picked up on another charge. So that lag time is what we had to deal with. And we decided we would look at 2 different models. One is the Vera Institute of Justice used a bond agency authority to work with people who have committed misdemeanor or accused of misdemeanors to get them to court. And I'm speeding up because there's 10 minutes left. So that's why I'm talking fast. So pay attention. The other one was the house arrest model. I figured, a lot of wealthy white people get to be out pretrial because they get to be in house arrest. So they get a guard, they get to be in their apartment, and
They get a guard?
well, they pay for a guard outside their apartment door, and they can be in house arrest. And I thought, why can't we
I
provide?
guess it pays to be wealthy and white.
Well, so
I can say that.
So I thought, why can't we make this model available for more people? So here's what we did for Hope House. Hope House is going to be, it's not open yet, but a facility that will provide therapeutic services for up to 2 years. You'll come to us through a mandate. You have to be competent to understand what's happening. You have to go voluntarily, and everyone has to agree. You have to have a felony charge, and pretty much not able to go anywhere else. If all those things happen and we agree to take you, we would tell the judge, we need you to set bail on this person. Don't, $50, $100, we'll pay the bail. What that gives us is bond agency authority, the same thing Vera used for misdemeanors. I'm a bond agent, so if I bail you out in New York, if you decide to leave once you come to Harbor House or Hope House, I can take you into custody and bring you back to court. I don't have to wait for the bond agent, the bench warrant to be issued. If in New York, if I bail someone out, I can pass on my authority to take you into custody to anyone who's 21 years or older. So what's going to happen is you'll come to Hope House, I will bail you out, and then I'll give my authority to our security people. We're going to have security on full time. They're going to be in the background. But that way, if a person comes to Hope House and they decide they don't want to be here, they'd rather go back to prison, that's okay because it's voluntary. They go back, and the bond agent or security person takes them back safely without that lag time. If they become violent or threaten violence, then they go back as well. So it's a way to provide a home environment. They can't come and go. They have to agree not to come and go unless they have a bond agent with them or security team. It gives them a therapeutic community, a place to live. They go voluntarily, but it's secure. It's not a private prison. It's voluntary, but it uses bond agency authority to basically have that house arrest model, but on a larger scale so that people on Medicaid, and we're working on the Medicaid issues, that's another story, we don't even have time for that, but hopefully we can get the Medicaid so that people who are not wealthy and can't afford security can nevertheless be diverted and get treatment and then be stepped down into the community.
That's awesome. And they're also receiving treatment while they're there, correct?
Absolutely. So there's residential staff 24 hours a day, and then there's clinical staff on site from 9 to 5.
Awesome, awesome. So I got to, okay, thank you. So quick question in 45 seconds. Your Honor, if there were one thing that you could, if there is one thing that you could do that could change the system overall, if you had some pixie dust that you can sprinkle over the entire criminal justice system specific to mental health and the criminal justice intersection, what would it be?
Well, the biggest problem that I have is if people have a place to live in the community, have an apartment, we're happy to put them back there and wrap services around them. But if they don't, they're in jail because they're poor. And they don't have family. And I know the city council is trying to address this. They just put $5 million into, and they've asked me if I would let people out pre-plea if they had beds for them, and obviously I would. So I mean, there's some glimmer of hope with that, but that's the critical, that's the critical thing that I need to make my court more effective.
Housing. Any housing developers in the room other than Mr. Greenberger? we need your assistance. Cheryl.
What would I do differently?
What would you do differently, or if there's one thing that you could do that could impact the system so that it can be far much more productive, that is more effective, and that is going to change the quality?
I think housing, we need a new set of institutions in this country. We need a continuum of care. We need some locked facilities or secure facilities, but we need a whole lot of other step-down facilities, and we need housing.
I would change the narrative, follow Rabbi Steerson's direction. The Japanese have a concept when somebody is an employee and they're not doing a good job, it's your obligation as an employer to help them do better, not just fire them and throw them out. And I think we have to understand that most criminals, I mean, once in a while there are a few really scheming people, but most criminals are acting out of some level of dysfunction. And we as a society have to take the position that we're not here just to punish them. We have to help them get better, do better, and become the responsible citizens that Rabbi Sneerson talked about, and that, in my opinion, should be the obligation of society.
Changing the narrative, changing the narrative. One of the things that we always say at Cut 50 is that language influences perception, and perception is going to influence policy. If you follow that thread, the narrative changes with the language that we assign to people. We're going to open the floor up for some questions, comments, concerns, critiques. You can ask a question. Again, the only criterion is that you what? Ask a question. The only criterion is what? That you ask a question. So we'll take about 3 to 5 minutes to ask a question. You can just throw your hand up and I'll call on you. I'll run up to you. We have our assistant over here in the back. She'll find you with a mic. Any questions, thoughts, concerns? Yes, ma'am. You are the only one in the room who does not get.
I just wanted to make a comment about something that you said. I don't think that there's a single judge in this room that would not admit that there have been people that they have seen who have gotten the raw end of the deal, and that the system has not, just done wrong by. I can't imagine. If there is, I don't think that person should be on the bench because they're not honest.
And you're qualified to say that. Why? Who are you?
Because I've been on for 18 years.
Yes, ma'am.
Okay, so.
And thank you for the work that you do. Yes, ma'am.
I'm curious, this is directed to Judge Amick. I'm curious what the recidivism rate is. I'm sorry. I'm curious what the recidivism rate is from your court, and how long most people spend, how long most of the defendants in it spend in the court before they're released.
When the court was planned way back when, the court made the timing was important to the defense bar. Everybody knows nobody's cured of a mental illness at a year, 18 months. But it was, since it was going to be a felony court, the mandate was 12 to 18 months for a first felony, 18 to 24 months for a second or more felony. And then there were some special cases, attempted kidnappings that we took, arson cases, very serious cases that the DA would say, well, I'll allow it, but only with a 3-year mandate or a 5-year mandate. And by and large, a year and a half would be the average time that people would spend in the court. Of course, if they do poorly, it's not fixed in stone, so it could be extended. With respect to the recidivism rate, it's interesting. I haven't. The Wall Street Journal did an article on the court about 10 years ago and asked about that, and since my mind doesn't generally work statistically, we looked at the Division of Criminal Justice. Everybody that comes into the system gets an identification number, and none of the difference. So we looked at all of the identification numbers, and I guess the court had been around for about 6 or 7 years at the time, and to see who had been rearrested. It turns out about 19% had been rearrested, which is pretty good actually in terms of New York State, and 11% of those arrests were for misdemeanors. The Aleph Institute did a study, and I thought it was a little bit flawed, but it indicated that we reduced recidivism by about 20%. So, either way, it's meaningful statistic. I like my study better, obviously. But, very few people have come back through. I mean, some do. Some get rearrested. They ask to come back into the mental health court, and we're happy to have them back. But, that's the best I can answer your question.
Thank you so much. Is that our time?
No, you have more time.
Oh, okay. Yes.
I have a question. I'm not sure who on the panel should answer it. I'll let you decide. I think the work that you're doing is phenomenal. Pull the battery. I think the work that you're doing is phenomenal, and like so many of the other themes of this entire summit, it's helping people who are helpless and really can't help themselves. A very practical question. Unfortunately, there's so many jurisdictions that can't afford and don't have mental health courts and don't have the kinds of facilities that are available to people in Brooklyn. We've got judges and prosecutors in this room, what recommendations can you give as a practical matter for judges and prosecutors who are in the classic system to help people who have mental health as opposed to simply warehousing them in prison?
Well, just briefly, I mean, it's true what you say in rural areas and where there are long distances between courts and programs. They don't have the benefit that we have in New York, because I don't have any trouble, aside from housing, finding programs for people to go to. One piece of advice I have is, I'm lucky enough in New York State that I have a clinical team. I have a project director, I have some social workers that work for me. Most of the mental health courts in New York State don't have that, but what they do have is a resource coordinator, a social worker that can help coordinate with programs and help with evaluations. You have to remember that the court clerks, the court officers, me, we're all there anyway. And so the cost in that regard is not exorbitant. You know, we'd be doing something else if we weren't doing this, but we're doing this. And that would be the advice I would give.
Just really quickly, so I was a local judge upstate, and I'm a bond agent upstate, 2 hours north, and it's a different world between upstate and here, completely different world. When I bail out people, I literally have taken them to the homeless shelter, which is a motel 20 miles outside where there's any services. So I think that we have to insist on our government leaders to make a change. We have to make the case to them based on, if nothing else, dollars and cents. That this makes no sense. I think it's it's a choice, it's a policy. You know, this isn't hard to fix. This is about money. This isn't rocket science.
I think that those are great words to end.
Oh, can I just have one?
Your Honor, it's such a pleasure to have you. Judge Dimick, Cheryl Roberts, Francis Greenberger. Let's give them a great round of applause. I believe that they'll be available for more questions, comments, critiques, or concerns shortly after. Thank you. Thank you, everyone.